नेक्स्ट इज अथा तो गर्भिणीव्याकरणं शारीरं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः. Garbhini Vyakarana is about the process of dealing with a labor. Garbhini Prathama Divasat Prakriti Nityam Prahasta Shuchi Alankrita Shuklavasana Shanti Mangala Devata Brahmana Guru Parati Bhavet Malina Vikrita Hina Gatrani Nasprashet Durgandha Durdarshanani Pariharet Udvejaniyascha Kathaha Shushkam Paryushitam Kuchitam Klinnam Chalnam Na Upubunjeta बहिर्निष्क्रमणं शून्यागार चैत्य स्मशान वृक्षाश्रयान् क्रोधम् ऐशस्करांश्च भावान् उच्चैः भाष्यादिकं च परिहरेत् यानि च गर्भं व्यापादयन्ति न च अभीक्ष्णं तैल अभ्यङ्ग उत्सादनादीनि सेवेत न च आयासेत् शरीरं पूर्वोक्तानि च परिहरेत् शयन आसनं मृदु आस्तरणं नात्युच्चम् अपाश्चयोपेतम् असम्बाधं च विदध्यात् हृद्यं द्रव मथुरप्रायं स्निग्धं दीपनीय संस्कृतं च भोजनं भोजयेत् सामान्यमेतद् आप्रसवात्. After the fertilization, the pregnant woman has to take care of her physical and psychological health in such a way that the progress of this fertilization and progress of the pregnancy doesn't get affected. And among them, the issues are simple. It's about either to maintain a proper level of this mental health, that you have to have the Shanti Mangala Devata Brahmana Guru Paraha, that auspicious environment has to be there, and physical cleanliness is to be there, and at the same time too many or very strong emotions like either too much of sorrow or happiness or so on, expression of those even psychological feelings also has to be avoided. At the same time, the physical cleanliness, like the contaminated food substances and the visions of some horrible issues or which produce fear as such, they have to be avoided. Even the exciting stories also have to be avoided, or this conversation of which produces excitation also should be avoided. Food which is dry and which is kept over for overnight, or which is decayed, or which has become contaminated, should be avoided. And she should avoid moving out and to areas where there is no protection or where there is a possibility of injury, like Shunyagara, where there is no one to take care of, or Chaitya is in the graveyards, Chaitya Smashana, and even the graveyards, as well as these auspicious places like temples, or she should not go below the tree. These are all the conditions which she has to take care of, and she should not practice Tailabhyanga, Utsadana, etc. repeatedly, should not exert too much, and should have a comfortable bed and a environment where she can be comfortable as such, and the food should be hridya drava madhura. It should be pleasant, and it should be somewhat more liquid, and should have more sweet or supporting these rather enriching the conditions. That should be the type of the food. Visheshastu garbhini prathama dvitiya tritiya maseshu madhura shita drava prayam aharam upaseveta. विशेषतस्तु तृतीय षष्टिकोदनं पयसा भोजयेत्. First 3 months, the first trimester, she has to take more of sweet and shitavirya dravyas, and particularly, very specifically, षष्टिकोदनं payasa, the with the milk, षष्टिका shali rice prepared as such. Chaturthe dadna, in the 4th month, the rice has to be eaten with the curds. Panchame payasa, in the 5th month again milk is suggested. Shashthe sharpisha, in the 6th month it's the ghee, rice and the ghee is suggested. Chaturthe payo namnita samsystam aharayed jangala mansa saitam hridyam annancha bhojayet. In the again 4th month again payo navanita samsystam aharam, milk and butter has to be mixed with the food, or jangala mamsa, and the rice has to be taken. Panchame Kshirasarpisam system, in the 5th month it has to be Kshira and Sarpi, milk and ghee which has to be mixed with the food. Shashte Shadamsra Siddhasya Sarpishah Matram Paye Yavagumha. In the 6th month, Gokshara Siddha, Gokshara Ghruta and Yavagu has to be taken. Saptame Sarpihi Pradakparnyati Siddham. In the 7th month, Pradakparnya Ali Siddha Ghruta, Pradakparni Ghruta, Evam Apyayate Garbha. These are the procedures by which the growth of the fetus can be stimulated. Ashtame Badarodakena, Bala Atibala Shatapushpa Palala Payo Dadi Mastu Taila Lavana Madana Pala Madhugrata Mishrena Asape, the Purana Purisha Subjectum Anulomanarthancha Vayo. By 8th month, you have to prepare the pregnant lady for the labor, and one of the first of the thing is anulomana of the vayu, and hence asthapan basti is suggested. Before 8th month, basti is not recommended. After the 8th month, basti is recommended, and basti should be prepared with the badara, bala, atibala, etc. the dravyas. Tataha payo madhura kashaya siddhena tailena anuvasayet. Then again anuvasana basti has to be given with the taila and milk and other sweet dravyas, mathura dravyas. Anlomehi vayu sukham prasuyate nirupradravati bhavati. When the vata becomes anulomana, the chance progression of the labor and the possibility of a normal labor would be enhanced and the complications would be lesser. Atavudhum snigdhabhihi yavagubhihi jangalarasihi च उपक्रमेत आप्रसवकालात् एवं उपक्रांत स्निग्ध बलवती सुखम अनुप्रद्रवा प्रसूयते. So the next after the 8th month, she has to give snigdha ahara, yavagu or jangala mansarasa. These are to be given, ensuring that it will have a normal. So ultimately, if at all it has to be summarized, it has to be, you have to take care of the nourishment, you have to take care of the physical and mental health of the mother as such. That's the important issue. Now, as far as the nourishment or nutrition of the pregnancy is concerned, there are standard guidelines about which are the essential nutrients which are required in pregnancy more than what the normal would be. The first of the column is a recommended dietary allowance of these specific vitamins as such in a non-pregnant woman, and during pregnancy the requirement is enhanced, and the requirement, some of the substances requirement is enhanced, in some it's the same, like this is about the standard protocol based upon the universal guidelines, and the required the estimated average requirement of the pregnant these vitamins in the second column. The third column is the tolerable upper limit as such. The fourth column is the tolerable upper limit, and the recommended and the estimated average requirement as such, and the recommended dietary allowances. How much has to be provided in the diet? This is the column. So these standard guidelines of providing vitamin A, D, E, K, vitamin B, and B, so on, all the series of the vitamins, as well as the electrolytes, calcium, iodine, iron, magnesium. These are now standardized, and the upper limit, the maximum tolerable limit of a person where these can be given also is now decided. So you are supposed to administer these vitamins and other supplements during once the patient has conceived, and this has become a standard guideline. And in the national health program related to the mother care, provision of these also has now become an essential issue. Then Navame Masi, after the 9th month, Sutikagaram enam praveshe prastheti khyado tatra aristam brahmana kshatriya veshashudranam shveparakta pita krishneshu bhumi pradesheshu bilva nyagrodha tinduka bhallataka nirmita savagaram mithasankam tanmaya pariyankam samupadipta bhiktim सुविभक्त परिच्छदम प्राग्द्वारम दक्षिणद्वारम व अष्टहस्तायतम चतुर्हस्त विस्तृतम रक्षा मंगल संपन्नम विधेयम सूचिकाकार. The labor room, the dimensions of the labor room is it has to have 8 arm length as the length of the issue, and chaturhasta vistrutam, 4 arm length wider. So 1 arm length is around 1 meter. So 8 into 4 meters is the dimension suggested by Sushruta about the size, and it should have a door either on the eastern side or on the southern side, and it should be prepared in a area where the soil is Shweta Rakta Pila Krishneshu. Either it could be red soil or yellowish soil or the black soil or Shweta, whitish soil area, and the furniture in the room has to be furniture in the sense that labor bed and any other furniture should be prepared out of Bilva, Negruda, Chinduka, Bhalla, etc. The trees of these have to be used to prepare that whole room, and the whole wall of the room has to be plastered well. Samupalipta bhitti is where it has to be plastered well. Sulbhakta parichadam, that should be a sufficient provision for maintaining the privacy. Parichada is to maintain cover the area. These are the requirements of a labor room. Now, from the current point of view, our National Health Mission has issued a document of 144 pages about labor room quality improvement in 2017, and this now has become not yet mandatory, but within a short duration it will become mandatory. So every labor room should have the provisions, and you have all the detailed issue, like what are the requirements of a labor room, including every aspect, like the manpower, instruments, every aspect is concerned. And there are some even 3-tier level of assessment of this also, and it becomes mandatory. So those who are now running any labor theatre should now start itself preparing for reaching to these ranges or this level of the labor room quality assessment. Though it's not yet mandatory, within a short duration it's going to be mandatory. One of the important criteria to decide about these would be based upon the do's and don'ts in the labor room or during the this handling of the labor. And those, it's simple: providing privacy to pregnant women during the transfer or interpartum period. These are the basic concepts of building up these criteria, and this is a very important document. It's available on the website of National Health Mission, and those who are dealing with the labor cases, they have to be aware of this. So that's why I have just recommended this. So there is a issue, or maybe a quite significant issue of what Sushil has said and what these provisions are there, but unfortunately there is no reference about the concepts of the labor room in Ayurveda. Rather, there are a few sentences which criticize the procedure of the labor in the folklore practice. Leave about that's apart from that, but it has become mandatory, and that's one of the issues which you have to be aware of. Now, the basic issues are: there should be providing privacy to pregnant, and then presence of birth companion during the labor. That's the partner also has to be there. Freedom to choose a comfortable position during the birthing, and adherence to clinical protocols, and use of labor beds instead of tables. Now, labor table instead of that. Now the shift is the labor beds as such. Then place baby on mother's abdomen. These are certain of the basic issues, and initiation of the breastfeeding within 1 hour of the birth. And those should be induction and augmentation of labor without sound clinical indication. These are all now have the guidelines, and it's going to be mandatory, and hence I have just quoted this. Any verbal or physical abuse of the pregnant woman should be avoided. Insisting on conventional lithotomy position for the delivery should be avoided. Immediate clamping and cutting of the umbilical cord also is not suggested, and these are considered as the criticism of the techniques of labor in the olden days. Then separating baby from the mother for routine care and procedure, and out-of-pocket expenditures on drugs, diagnostics, etc. should not be demanded. These are the guidelines, and the whole concept of that would be respectful maternity care and cognitive development of the baby. That's the idea, and the whole protocol of Lakshya is based upon these issues. So anyway, those who are interested, they can go through that article thoroughly. At the same time, National Health Mission also has provided another guideline, which is for the mother, My Safe Motherhood, where the dietary requirements and all other requirements, and training for the mother is provided, and hence those who are in the practice of dealing with the labor issues, they should be aware of this, and still it's not yet legally mandatory, but in due course of time all these issues become legally mandatory. And the diet during pregnancy, there is a strong recommendation of the dietary requirement, and again unfortunately there is no mention about the dietary protocols mentioned in Ayurveda. Anyway, our council has to take maybe has to be alert about it, and there is a provision for any of you to recommend or involve in this procedure. The Pradhan Mantri Suraksha Matrutva Abhiyan is one of the parts of the National Health Program, where anybody can volunteer. If you are ready to volunteer, go to the website and then recommend your suggestions as such. That's about the other issue. Now coming to the issue of labor, जाते हि शिथिले कुक्षौ मुक्ते हृदयबन्धने सशूले धगने नारी ज्ञया सातु प्रजायिने तत्र उपस्थितप्रसवायाः कटिपृष्ठं प्रति समन्तात् वेदना भवति अभीक्ष्णं पुरुषप्रवृत्तिः मूत्रं प्रसिच्यते योनिमुखात् श्लेष्मा च. Onset of the labor is suggested by the signs of the first is jate hi shithile kuksho. There is a what we call as a capsule. The fetus would be moving towards the presenting part, and hence the mother would feel a lightness or heaviness in the lower abdomen and lightness in the upper abdomen. The whole movement is felt by the mother, and she feels like there is something like a loosening. That's the first of the feeling. Then that's what Mukta Hridaya Bandhane. The discomfort in the upper part of the body is reduced, and the heaviness and the discomfort would be moving towards the lower part. And there would be onset of the pain. The onset of the pain, differentiation between the true pain and the false pain, of course, all that we have discussed in the earlier chapters. So, onset of the pain is another of these issue, and the plug, the mucus plug getting discharged out. That's the first sign of a labor onset. So, and then of course, if there is a leakage of the amniotic fluid, that's confirmed that the labor is on and it's irreversible. It cannot be avoided. Then the dilatation of the cervix is the other criteria to confirm whether the labor is progressing or not. Again, all those issues we have discussed in the previous discussions. But what Sushila has said is the same, like the tatra upasthita prasavaya kati prastham prati samantat vedana. A true pain will be feeling like a tightness around the whole pelvis, and that's exactly the feature. A true pain and false pain can be differentiated by the nature of the pain. A true pain will be having a surrounding tightness, feeling of a tight effect over the whole of the abdomen as well as the pelvis, and the patient may feel like having more frequent defecation or urination. That's also again due to the contraction of the pelvic muscles and the precipitate yonim karsleshma. That yonim karsleshma is the mucus plug which is coming out. Now that's exactly the same. If you look at any obstetric textbooks and see the signs of onset of the labor, and whatever Sushila has mentioned is exactly the same. Prajanishyamanaam kritamangala swastivachanam kumara parivrutam punnama falahastam Sobhyaktam Ushnodaka Parishiktam Atha Yenam Sambratam Yavagum Akanthat Payet Tatah Kritopadhane Mruduni Vistirne Shayane Stitam Abhugna Saktim Uttanam Ashankaniyam Chatusraha Striyaha Parinatavayasaha Prajanana Kushalaha Kartitanakaha Parichareyu Iti. Now according to Sushruta, there should be 4 assistants in the labor room, and those should be females, and they should have experience, prajanana kushalaha, they should have experience of handling the labor, and they should be of optimum age, parinatabayasaha, they should have the experience of having the labor, or they should be of optimum age. Kartitanakaha, their health has to be, and their hygiene also has to be taken care of. They have to take care of their nails have to be cut short, and that's one of the important requirement of the labor room assistants. And then once the patient is under labor, she has to be taken into the labor room, and there you have to have Mangala Swasti Bhajana. She should be consoled, like say, counseling is needed. Protocol of the labor room has to be explained to the patient, and her psychological status has to be maintained in a positive manner. So Kumara Parivartan, maybe some other child, if the mother is having another child, the other child has to be with her till she enters in, not that during the labor, so that she would have that confidence. And Punnama Palahasva, though, because in general there is a tendency to have the male child, uh, whether this is justified legal issues, that's another issue. We'll not go into that controversy. But in general, that because the general tendency is to have a male, the labor, this mother has to have a feeling, positive feeling towards the male, and hence the fruits and flowers which have the male name, they have to be handled, or they have to be given to the mother, so that she would have a psychological feeling which of the positiveness. Then she has to be given an abhyanga with the Ushna, the warm water, and Yavagum Akandhampayet, she should be given light liquid food till full of the stomach. Now, this is again controversial. From the present day's point of view, a mother in labor is not given too heavy food, like or too much of food. It should be only minimum requirement has to be given. Rather, it's better to keep a meal orally till you decide like whether the normal labor can progress or not. And the nourishment has to be taken care of, but stomach is not suggested to be full during the labor. Whereas Sushil has suggested the other way, Yavagum Akandham Payet, Yavagu has to be given till full stomach, and Kusapadhane Mrudini Vistirne Shane, she should have a coverage and she should lie down on a soft bed. And the recommended position for the labor by Sushruta is a lithotomy position. Abhukna Sakti Muktanam Ashanka as such. So, whereas now the tendency now has, and the trend has now been changed, and it's not necessary that it should be lithotomy position, and rather it's now you have plenty of other choices now, and there is some fancy like labor underwater and so on. And as per our Lakshya protocol, all these have to be encouraged, and it's not that lithotomy position is recommended. There is some view that the lithotomy position can result in precipitate labor also, and hence that's not recommended now. Anyway, that's about the controversy about the position of the labor. There could be more discussion on some other context, but for the present we will stop at that. अथास्य विशिकान्तरम् अनुलोमम् अनुसुखम् अभ्यर्च्य अनुभूयात् एताम् एका सुभगे प्रवाहस्व इति न च अप्राप्तवायि प्रवाहस्व ततो विमुक्ते गर्भनाडी प्रबन्धे सशूलेषु श्रोणिवंशनबस्तिशिरस्सु च प्रवाहेताः शनैः शनैः ततो गर्भनिर्गमे प्रगाढं ततो गर्भे योनिमुखं प्रपन्ने गाढतरम् आविशल्यभावात् अकाल प्रवाहणात् बधिरं मूकं कुब्जं व्यस्तहनुम् ऊर्ध्वाभिगादिनं कासश्वासशोषोपद्रुतं विकटं वा जनयति. Now, once the pains have started, you have to identify which are the true pain and which are the false pains. And the initial pains will be milder. Gradually, the pain becomes stronger and more, and the duration of the pain and contraction of the uterus also would be enhanced. And the patient has to be given a support, and the patient has to be counseled to support that pain by the advice of the assistants. The assistants have to look at and observe, and they are supposed to comfort the mother by applying some taila over the hairline, the mid hairline. Vishikantaram is the mid hairline. When you comb the hair, you will see a line like, and that's the line is the Vishikantara. And there you have to apply some oil, abhyanga, and she has to be advised to have support the pressure, support the pain by putting the pressure. But the pressure should be gradual, should not be too much. Unless there is a natural onset of the pain, mother is not supposed to press down, and only when the pain has become stronger and when the fetus has reached to the cervix area, then only there should be a stronger pain. So initially, gradually, it has to be slow supporting, like or straining. Too much of straining during the labor is contraindicated, and at the moment the presenting part has reached the cervix, you have to advise the mother to press harder so that the fetus is expelled out. And Sushruta has clearly mentioned like Akala Pravahana. If at all the mother strains too much before the real onset of the contractions and the progression of the labor, or rather the pressure of the pressure support of the mother and the natural contractions, they are not synchronized. In that condition, there is a possibility of fetal abnormalities, and those fetal abnormalities could be Badhira, deafness, Muka, dumbness, or Kubja. The growth could be affected, or Vesahanu, the chin could be damaged, or Urdhvapigajanam, the presenting part should be maybe injured, or in due course of time, the child also may have Kasa Shwasa Shoshan. Either it could be meconium ileus also, maybe whatever, there could be the swallowing from amniotic fluid and so on. The complications can occur, and that's exactly which can result in aspiration, Kasa Shwasa also. Tatra pratilomam anulomeyad prandilam akarshetam. If at all the progression of the labor, during the progression of the labor, the presenting part is seen as such, then it has to be gradually pulled down, and once the extension of the neck or extension of the presenting part is done, then you have to pull down further. Now these issues we have discussed when we have discussed about the Mudagarbha in the earlier conditions, like the whole stages of labor and how to assist labor and the different movements of the presenting part we have discussed in detail there, so I will not repeat that. Garbhasanketu yonim dhupayat Krishnasarpa nirmokena pinditakena va Padniyat Hiranya Pushpi Moolam Hastapadayoho Dharayat Suvarchalam Shalyacha. If the progression of the labor gets arrested at that stage, at the first stage, at the end of the first stage of the labor, it's not progressing, like then there are certain choices which are suggested by Shushla, like a dhupana with the scales of Krishnasarpa or Pinditaka, or Hiranyapushpi Mula, Hiranyapushpi roots of Hiranyapushpa has to be tied over the hands and the legs, or Suvarchala or Vishalya, they could be tied. Of course, whether these can really have an effect or not, we do not know. I don't think that any such trial has been done, but it's worth of trying. Ata jatasya ulbam mukham cha saindava sarpisha vishodhya घृतात्म मूर्ति पितुम दद्यात ततो नाभि नाडीम अस्तांगुलम आयम्य सूत्रेण बद्ध्वा छेदयेत तत् सूत्रैकदेशं च कुमारस्य ग्रीवायां सम्यक् बध्नीयात. Once the baby has been delivered, the oral cavity as well as the presenting part has to be cleaned with the saindava and ghrita, and the ghrita has to be applied over the scalp also, over the bregma. Then the umbilical cord has to be tied with the astangula, 8 angulas dimension from the body of the fetus. It has to be tied with a thread, and then it has to be cut off. So umbilical cord has to be cut after taking care of the baby's hygiene, particularly cleaning of the oral cavity, respiratory tract. Now you do the suction now in the labor room. Now we do the suction. Whereas Sushruta says you apply Saindava and Sarpi and clean the whole area with your fingers, and similarly to facilitate or stimulate the baby to have the breathing and getting adjusted to the external environment, Sushruta suggests about a pitu of ghrita over the bregma. Now the protocol is almost similar, but you may not apply that ghrita. Instead, you have to do the suction and ensure that the baby is responding to the external stimuli, take care of the breathing, and then of course the umbilical cord has to be cut. Then Ato Kumaram Shitabhiha Bhiya Ashwasya Jata Karmani Krite Madhusarpiya Arantachurnam Angulya Anamikaya Lehayat Tato Balata Elena Bhyadya Shira Vrikshakashayana Sarpagandhutakena Va Rupya Hema Prataptena Va Varena Snataye Enam Kapitta Patrakashayana Chakpa Kusnena Yatha Kalam Yatha Dosham Yatha Vibhavancha. Now the once the child had this umbilical cord is cut, the baby has to be stimulated, or baby has to be made comfortable and ensure that the baby is breathing properly. Now of course now the protocol is you have to assess the scoring and vitality of the baby. Apgar scoring, I think again what we have discussed earlier, that has to be taken care of, and that's what we call as a jata karma. Sushruta has mentioned about the jata karma in the sense the protocols which are to be done during the birth. And if you look at the details of the Jatakarma in Atharva Veda, it's almost similar as that of what we do as a protocol. In the Jatakarma, you have to the issue is now you have a standardized protocol of the scoring of the possibility and assessing the vitality, whereas in Atharvaveda it's meant just like in the expressed in the form of a mantra by which the baby is made alive and maybe requesting the universe to support the baby. That's what the mantra contains, like. And almost it has similar issues like maintenance of the respiration, maintenance of the vitality, and the facilitating the growth. These are the issues of the mantras which are mentioned there in Jatakarma. Only thing is they are mentioned in the form of a subtle suggestion, whereas now you have a standardized protocol. Then further the child is given Madhu Sarpi Ananta Churnam Angula Ananta Churna, that's Sariva Churna with the Madhu and Sarpi has to be given small quantity with the Anguli, with the fingers, and then Balataila Abhyajya, the baby has to be given a bath with Balataila, and the baby has to be bathed in either Shiravuksha Kashaya or Gandhodaka or water which is boiled in silver or golden vessel, and Kapitapatra Kashaya or Kapitapatra Kashaya also can be used for bathing of the baby depending upon the availability of the substances. दमनीनां श्रुतिस्थानां विवृतत्वात् अनन्तरं चतुरात्रात्रिरात्राद्वा स्त्रीणां सन्न्यं प्रवर्तते तस्मात् प्रथमे अह्नि मधुसर्पिः अनन्तमिश्रं मन्त्रपूतं त्रिकालं पायेत् द्वितीये लक्ष्मणासिद्धं सर्पिः तृतीये च ततः प्राङ्निवारितः स्तन्यं मधुसर्पिः स्वपाणितलसंहितं द्विकालं पायेत्. Now another bit controversial issue. Sushruta says the milk will be produced by about the third or fourth night. Triratradva, Chaturatra, Triratradva, fourth or third night, the milk will be formed in the mother's breast, and hence for the first 3 days, child has to be given, the newborn has to be given Madhu Sarpi Anantamishtam, either Madhu Sarpi second day Lakshmana Siddham Sarpi, second day with the Lakshmana and the Ghrita has to be given, and Tritiya on the third day the first milk has to be extracted out, and then the child has to be given has to be breastfed. This is what Sushruta says. But now from the present protocol point of view, that's not justified, that's not correct. Rather, the child newborn has to be initiated into breastfeeding immediately after the birth, and the colostrum, the first thick collection, is known to have lots of nutritional value as well as immunological benefits, and this is the standard protocol. And avoiding the breast this milk suction by up to third day is not considered to be the optimum. Even though the mother may not have the milk, simply suckling stimulus is considered to be one of the stimulus which facilitates the production of the milk, and hence the suckling has to be continued. Assessment rather this encouragement of the breastfeeding should be done as early as possible, immediately after the delivery. This is the standard protocol now. So controversial issue is about the Prang Nivarita Stanya, the first milk to be removed and extracted out, as Sushruta says, or the colostrum which is suggested to have beneficial value now is a controversial issue. But now it's proved that the colostrum has definite advantages, and hence we need to adopt the present protocol. We will not go by what Sushruta has said there. Then Athasutikam Balatailam Bhiktam Vatahara Aushadi Nishkatena Upacharet. Then the mother has to be taken care of, and the mother has to be given a Abhyangana with Balataila, and she has to be the whole presenting part, and all that areas have to be cleaned with the Vatahara Aushadik Patha. Sashesha dosham tu tadaha pippali mula hasti pippali chitraka shundaveraturnam budodakena usnena payet evam triratram kuryat adushta shonitat. Because there is a possibility of shonita dushti, rakta dushti there, that's the possibility of sepsis. To prevent that, Sushruta has suggested about pippali mula gaja pippali shundaveraturnam, that Shadushara Churna with Gudodaka in the initial days, and this has to be given for 2 or 3 days to prevent the possibility of sepsis. Then we should take, once we are sure that there is no septic complications, Sneha Yavagum, Shira Yavagum Vaye, for the next 3 days, Yavagu with the Sneha Dravyas or Yavagu with the milk has to be given. Yavakola Kulata Siddena, Jangala Rasena, Shalyodanam Puja, the Balam, Agni Balam Chabeksha. She has to be given a nourishing, light food of shali, rice of the shali, with the Yavakola Kulata or the Jangala Rasa, Mamsarasa, has to be given considering the Agni Bala and the other aspects. Anena Bijina, Adhyartha Masam Upasamskruta, Vimuktahara Achara, Vigata Sutika Abhidhana Syata. By 1.5 months, till 1.5 months, she is to be considered as Sutika. She should be protected and to avoid the complications. And according to some, she has to be considered as a Sutika till she starts the menstruation. But according to Sushruta, it should be 1.5 months. 1.5 months is the time, 45 days is the time during which the mother has to be taken care of as a special case or as a post-puerperial period. So, limitation of the post-puerperial period is now, according to Sushruta, it's 45 days. According to some, it's about till the mother has a menstrual flow. But from the present protocol point of view, it's around 2 weeks. 2 weeks is considered as the post-puerperial period. But any complications which occur up to 3 months of the puerperium, they are considered as post-puerperial complications. So that's also the other issue from the current protocol point of view. धर्मभूमिजातं सूतिकां घृततैलयोः अन्यतरस्य मात्रां पायेत पिप्पर्यादिकषायानुपानं स्नेहनित्यां च स्यात् त्रिरात्रं पञ्चरात्रं वा बलवती अबलां यवागुं पायेत त्रिरात्रं पञ्चरात्रं वा अत ऊर्ध्वं स्निग्धेन अन्नसंसर्गेण उपचरेत. Dharmabhumijata is dry areas. The delivery which has occurred in the dry area, where the environment is dry and the nourishment is poor, like there is maybe desert area is Dharmabhumi. In such areas, she has to be given Ghrita and Traila in the initial stage with the Pippalya Kashaya. Ghrita and Traila, Sneha Dravya have to be given in the beginning itself. Abalam Yavagum Payet, if she doesn't have sufficient strength, on the third day itself Yavagu can be given. So that food supplementing of the mother would be depending upon the environmental factors also. अथवा स्निग्धेन अन्नसंसर्गेण उपचरेत. प्रायश्च येनां प्रभूतेन उष्णोदकेन परिषिञ्चेत क्रोधायासमैथुनाद्यंश्च परिहरेत. Always preferably she has to take bath in warm water, and all psychological and physical straining has to be avoided. मिथ्याचारात् सूचिकायो व्याधि उपजायते सकृच्छसाध्यो असाध्यो वा भवेत् अपि अपतर्पणात् तस्मात् तां देशकालौ च व्याधि सात्वेन कर्मणा परीक्ष उपचरेत् नित्यम् एवं न अत्ययम् आप्नुयात्. If the puerperial period is not taken care of properly, it can result in the diseases, and the diseases become either Krishnasadhya or Asadhya. Any disease which occurs in the post-puerperial period is having more complications, and the complications also can occur due to poor nourishment, and hence considering all the variable factors like the environment, season, area, geographical areas, and the possibility of any other diseases, you have to take care of her and ensure that there is no complications. That's what Swisra said. Atha apara apasantyam anaha admano kurute tasmat kantam asyaha keshavesthitaya angulya pramrjeta katuka alabukrita vedhana sasyapa sarpa nirmokirva katutaila vimishrehi yonimukham dhupayeta langali mulakalkena va asyaha panipadatam alimpeta मूर्तिमा अस्याह महावृक्षक्षीरम् अनुसेचयेत कृष्णलाङ्गली मूलकल्कं वा मूत्रयोः अन्यतरेण पायेत शालमूलकल्कं वा पिपल्यादिं वा मध्येन सिद्धार्थक कुष्ठलाङ्गली महावृक्षक्षीरमिश्रेण सुरामण्डेन वा आस्थापयेत एतेनैव सिद्धेन सिद्धार्थकतैलेन उत्तरबस्तिं दद्यात् स्निग्धेन वा कृतनकेन हस्तेन अपहरेत. Now one of the complications which can occur immediately after the delivery could be a failure to have the placenta, the third stage of the labor, where the placental expulsion should occur naturally. If it doesn't occur, if there is a retention of the placenta, either a partial extraction or maybe retention of the placenta has occurred, the products of the, or maybe at times what happens is some parts of the placenta may be retained in, and then it can result in later complications of either persisting hemorrhage, postpartum bleeding, or sepsis, and so on. So to prevent that, the protocol is you have to ensure that the placenta is delivered completely, and the moment the placenta is delivered, the protocol is you examine the placenta completely, see that if there is any portion left over. So that's a standard protocol now. And Sushila also says the same, like you have to see that the placenta is delivered. If it doesn't get delivered, then to promote that extraction of the placenta, there are certain guidelines suggested, and those are: one, stimulate the mother's throat, the palate, with either some hair tuft or maybe fingers, so that there would be strong pelvic contractions and the pelvic contractions would expel out. If it doesn't, then you may have to dhupana, the fumigation of the vagina with the different drugs like katukala, bhuktavedana, etc. Or you may have apply a lep over the hands and the leg with the langali mula, or you may apply sechana, or you may pour the liquids of Mahavriksha Kshira over the scalp, or she may be given Kushta Langali Mula Kalka with the Madhya or Mutra, with the alcohol or with the urine. There are Pipalyadiva Madhyana, Pipalyadikrita also can be given with Madhya, and or Suramandana, Siddhartha Kushta Langali, etc. So administration of the drugs orally, or Astapan Basti with the Siddhartha Kushalangali, or it could be also Uttar Basti. Yetena Siddhena Siddhartha Kailena Uttar Basti Mavidadyata. So Astapana or Uttar Basti are suggested, or a manual removal also is suggested. Depending upon the condition, you may have any of these choices. प्रजातायाश्च नार्याः रूक्षशरीरायाः तीक्ष्णैः अविशोधितं रक्तं वायुना तद्देशगतेन अतिसमृद्धं नाभेः रन्ध्रः पार्श्वयोः बस्तौ बस्तिशिरसि वा ग्रन्थिं करोति ततश्च नाभिबस्ति उदरशूलानि भवन्ति सूचीभिरिव निस्तृत्यते भिद्यते दीयते च पक्वाशयः समन्तात् आध्वानम् उदरे मूत्रशङ्कः च भवति इति मक्कल्ल लक्षणं. Makkalla is one of the most common complications, like retention of the placenta resulting in septic complications. Now actually it says sepsis and the hematoma formation there, and that's what exactly what Sushil has said. The clinical presentation of that is exactly the same due to that accumulated abnormal substances, and because of the ruksha sharira, because of the improper preparation of the labor, the avishodhita rakta is either retained placental products or the other issues. It can result in a swelling in the supraumbilical or suprapubic area below the umbilicus, or maybe on the sides in the pelvic area. It produces a palpable mass, granthim karoti, palpable mass is felt, and there could be pain, nabhibasti udarashulani bhavanti, there could be pain which would be quite acute, and even it can affect the movement of the food in the colon. There could be the peritonitis signs that pakvashaya involves, and these are exactly the clinical signs of postpuerperal sepsis. And such conditions, suggested treatment is Viratarvadi Siddham Jalam Ushakadi Prativapam Payet. So Viratarvadi Gadam Siddha Kashaya, or Yavakshara Churnam or Sukhotakena Pipalyadipatena, Yavakshara Churna with Pipalyadipata, or Pipalyadichurnam or Suramandena, or Pipalyadichurnam with the Sura, Varanadikwatam Panchakolatela Prativapam, Varanadipata, or Pratikparanadikwatam, Bhadradaram Marichasam system, Purana Gudamma, Trikatuka Chaturjata Kustumbara Mishram Khadeta, Achama Pibed Aristam. The medicines which could be recommended in case of the postpuerperal sepsis are these lists of the medicines. अथ बालं क्षौमपरिवृतं क्षौमवस्त्रास् आश्रयां शय्यायां पाक्षायेत् पीलुबदनी निम्बपरुषक शाखाभिः शयनं परिविजयेत् मूर्ध्नि च अस्य आहारः तैलपिजुम् अवचारयेत् मूर्ध्नि अस्य अहरहः तैलपिजुम् अवचारयेत् धूपयत्ययनं रक्षोघ्नधूपैः रक्षोघ्नानि च अस्य पाणिपादशिरोग्रीव ग्रीवासु अवसृजेत तिल अतसि सर्षपकणश्चात्र प्रकिरेत अधिष्ठाने च अग्निं प्रज्वालयेत व्रणित उपासनीयं च अवेक्षेत. Now, the newborn has to be taken care of in a clean bed with the soft bed as such, and the ventilation of the room has to be maintained. And to ventilate the child, you may use a pan prepared out of pilu, badara, nimba, etc. The plants, their leaves could be used to have a fan-like activity, so that the ventilation at that area is maintained properly, and child, the newborn gets a sufficient air movement. Then one of the protocol is applying thaila pichu over the scalp regularly, repeatedly. That thaila pichu has to be kept over the scalp. Now, of course, you use some powders like over the scalp, which dries up, but Sushruta has suggested thaila, oil over there. Then Rakshogna Dupa is suggested, and Rakshogna Dravya has to be kept around the area, and it could be Tila, others, Sarshapa, etc. It has to be kept in. Then the room has to be kept warm with the Agnyadhisthana, and this warmth is depending upon the environmental condition. In cold seasons, it has to be kept warm with the fire in the room as such. And all the protocols of Pranita Upasana have to be taken care of. The wound, that's a possibility, the umbilical cord being cut is the first of the wound anybody would have, and the protocol of protecting the child and healing of the wound has to be taken care of. On 10th day, Mata Pitaro Kritamangala Kautuko Sustivatanam Kritva Nama Kuriyatu Yadhapi Pretam Nakshatra Namava. The Namakarana, naming ceremony, is suggested to be done on 10th day with all that religious protocols. Tato yathavranam dhatrim upeyaat madhyam pramanam madhyam vayaskam arogam shilavatim achapalam alolupam akrasham asthulam prasanna kshiram alamba ostim alamba urdhvastanim avyangam avyasananim jivatvatsam dogdhrim vatsalam akshudra karminim kulejatam ato bhuyishteshcha gunaihi anvitam Shamam, Arogya Balavruddhiye Bharasya. Now, another issue is about the Dhatri. That's the one who can feed the child, the breastfeeding as such. Now, this concept is either when the mother is not able to provide the milk properly, or it's also related to the older conditions like whereby queens of maybe those are upper class, they may not be interested in breastfeeding. In such conditions, it is suggested like there should be an alternate source of the milk, and the alternate source of the milk is then having by some other assistants who have recently delivered, and their qualities, their physical and mental qualities are suggested. So you have to have a there is no equivalent word in English. Maybe the feeding mother. So it could be like two feeders, maybe breastfeeders are to be appointed, and the breastfeeders should be selected based upon the physical characters, and among them the important are the shape of the breast and size of the breast also is important issue, and she should have affection over the child, and she should be ready to feed the child properly, and her health also has to be considered. Now the complications can occur could be urdhvasthani karalam kuriyat. If the breast of the feeding mother is directed upwards, it can result in the abnormal shape of the mouth. Karala is where the face becomes prominent. The newborn's child becomes face becomes prominent and become bigger. And lambastani nasikam kam chadayitva maranam apadayati. If the breast is too big and it's hanging, it can cover or maybe block the nasal blockade, and even death can occur. Prashastayam titau shirah snatam ahatavasasam udam mukam shishum upavesha dhatrim pramukmita upavesha dakshinam sanam dhautam ishat parisrutam abhimantre mantrena nena payet chatvara sagara tubhyam stanayo kshiravahina bhavantu subhage nityam balasya balvardhe payo amritarasam pitva kumarasteshu bhanane dīrgham ayu apnotu devaha prashyamritam yadha. Now, that feeding mother has to be given, the breast has to be cleaned after having a bath as such. With the breast has to be cleaned properly, and she has to, that initiation of the breastfeeding has to be done with a mantra, and that mantra will be having that worshipping of all the four oceans, and the power of that capacity of the power has to be reached toward that, and all the natural forces of the vitality has to reach to the breast. That's the theme of the mantra. Now, whether it has to be only a person other than that of the mother, or whether the same protocol has to be followed even in case of a real mother, this is the questionable issue. I think the same protocols would be applicable even for the real mother who feeds the child. The idea of having a rental mother and breastfeeding there is now somewhat looks odd. Rather, now we have the concept of a breast milk bank. The concept of the breast milk bank now is well known, and stored breast milk can be given to the newborn in case where the real breastfeeding is not possible due to any other variable conditions. अथवा अन्यथा नाना स्तन्योपयोग सात्म्यात् व्याधिजन्म भवति. If you do not follow these protocols, there is a possibility of the complications produced due to the improper breastfeeding. अपरिश्रुते अपि अतिस्तब्धस्तन्यपूर्णस्तनपानात् उत्साहितस्रोतस्य शिशोः कासश्वासवमी प्रादुर्भावः तस्मात् एवं विधानां स्तन्यं न पायेत. Now, if the either there will be situation where the milk is not flowing out, or there could be a situation where the breast milk could be flown out very rapidly. In both the conditions, if the child is made to suck the breast, it can result in respiratory complications, and hence it should not be given. So the rate of the flow of the milk also has to be assessed when you suggest about the breastfeeding. क्रोधशोक वात्सल्यादिविषय स्त्रियः स्तन्यनाशो भवति. अतस्याः क्षीरजननार्थं सौमनस्यम् उत्पाद्य यव गोधूमशाली षष्टिक मांसरस सुरा सवीरक पिण्याक लशुन मत्स्यक कशेरुक शृंगाटक बिस बिदारी कंड बिदारी कंड मधुक शतावरी नालिका अलाबु कालशाक प्रभृति निवेद्यात्. The breast milk may not be properly formed either due to psychological factors of the mother, or it could be due to the other physical conditions. If there is a psychological factor, that has to be corrected by Saumanasyam Utpadya. You have to make her feel comfortable, and if necessary, you have to provide sufficient nourishment and medicinal supports like Godumashali Shastika Mamsarasa. These are the nutritional nourishment. Then Visavidari Kanda Madhuka, these are the drugs which are suggested to stimulate the formation of the milk. Now, Athasya Stanyam Apsupariksheta, you have to confirm the quality of the milk, and that one of the tests for quality assessment of the milk is Appariksha, dipping the milk in water. तच्चेत् शीतलम् अमलं तनुशङ्खावभासम् अप्सु न्यस्तम् एकीभवं गच्छति अफेदिलम् अतन्तुमत् न उत्प्लवते अवसीदति वा तच्छुद्धम् इति विद्यात्. तेन कुमारस्य आरोग्यं शरीरोपतेव बलवर्धिश्च भवति. When you put a drop of the breast milk in water, it should get mixed homogeneously with the water and produce a rather impression of Shankhavasam, something swirling movement. As the drop is placed over water, it should just move in a form of a spiral or swirling movement, and then get mixed with the water homogeneously without any foam formation. Then it has to be considered as a Shuddha milk. So that homogeneity with the water is considered to be the best quality of the milk. न च क्षुधित शोक आर्तश्रांत प्रदुष्ट धातु गर्भिणी ज्वरित अतिक्षीण अतिस्थूल विदग्ध भक्त विरुद्धाहार तर्पितायाः स्तन्यं पायेत. नादीन औषधं च बालं दोषौषधमलानां तीव्र वेगोत्पत्तिभयात्. Now, the condition of the mother, physical and psychological condition of the mother is important. If the mother has either physical illness or psychological illness, then during that condition, the milk should not be given. Breastfeeding should be stopped. Then, if the child has not digested the milk consumed earlier, or the medicines are not completely digested, during that period, milk should not be given. दात्र्यास्तु गुरुभिः भोज्यैः विषमेः दोषदैस्तदा दोषाः देहे प्रकुप्यन्ते ततः प्रदुष्यति मिथ्याहारविहारिण्याः दुष्टाः वातादयस्त्रियाः दूषयन्ति पयस्तेन शारीराः व्याधयः शिशोः भवन्ति कुशलास्तस् तांश्च Bishop Samyak Vibhavayat, the physical condition of the mother is one of the important issue when you feed the breast as such. Now about the breastfeeding also, in the same guideline of the mother which I have referred to, that the breastfeeding and complementary feeding, the standard protocol suggested by the central government National Health Mission is mentioned there, and now it's mandatory that you have to follow the same protocols. Of course, they are almost similar. Maybe the issue is they are discussed in the present days what it's like. Then Angapratyanga deshe ruja yatrasya jayate muhurmuhu sprishatam tam sprishamane च रोदिति निमीलिताक्षो मूर्धस्ते शिरो रोगेन धारयेत् बस्तिस्ते मूत्रसंगार्तो रुजा तुष्यति मूर्च्छति बिन्मूत्रसंगे हि वैवर्ण्यात् छर्दि आत्मानान्तरकुजने हि कोष्ठे दोषान् विजानीयात् सर्वत्रस्तां शरोधनेः. Assessment of the possible diseases in the newborn, because unlike the adults, the newborn cannot give you the history, it has to be done by the keen observation. And the most common presentation would be the child would be weeping more and restless, and the child would be touching the areas of the body where there is a pain. Depending upon that, if the child touches the head, then you may have to suspect the diseases in the head. If the child is touching the pelvic area, it has to be suspected that it could be the abdomen. If the child has vomiting or retention of the urine, then you suspect the disease in the abdomen, acid, and so on. So, tesham tu yatha abhidam mrudu chedani amshadam matraya kshirapasya kshirasarpisha sayuktam vidadhyata dhatriyascha kevalam kshirannada sya atmani dhatriyascha purvavata annadasya kashayadinam atmanyemacha nadhatriyaha. Now, administration of the medicine to the newborn is one of the issues, one of the critical issues. What is the dose and so on. Now, what Shushruta has suggested is if the child is having the breastfeeding, it's in the stage of breastfeeding, breast milk consumption, then the drug can be given to the mother, and along with maybe some drugs which can be given to the child. Now, administration of a drug to the mother and the expecting that drug to act on the child is one of the serious issues from the current pharmacological point of view. From the current pharmacological point of view or current legal issue, this is not justified. You cannot just give anything like you can tackle with the physiology of another living being for the sake of another living being. So there is a legal issue also. From the current point of view, that kind of a concept may be may have to be reviewed with the current legal issues, which is not justified. But from Ayurvedic point of view, this is one of the protocol. In the folklore practice also, this is done regularly. Like if a child has fever, then mother is given some medicine by which the child will be better. But once the child has become annatha, child is depending upon the food from other sources other than that of the breast milk, or child is on complementary food substances, then the drug has to be given to the child as such. तत्र मासादूर्ध्वं क्षीरपाय अङ्गुलिपर्वद्वय ग्रहणसंहिताम् औषधमात्रां विदद्यात् कोलास्थसंहितां कल्कमात्रं क्षीरान्नादाय कोलसंहिताम् अन्नादाय. Now the dose of a drug is decided in child. Now for the newborn and the child who is still depending upon the kshira only, then up to about 1 month, then suggested dose of any mrudu aushadhi. Now here not the tikshna aushadhi, mrudu aushadhi is anguli parvadvaya grahana samhitam, the drug which can stick to the two phalangeal areas of the finger. So up to the two markings, the first two phalangeal areas of the finger, it has dipped in the drug, and the drug which sticks to that is good enough for the child. Or kolasmatram kalkamatram kshiranadaya, the child who is having complementary food along with the breast milk, it should be size of the kolasti, badara fruit as such. Kolasamhitam, the seeds of the badara fruit for the kshiranada, and later annadaya, the child when the child is able to consume the food alone and is weaned of the breast milk, it should be kolasamhitam as size of the fruit of badara. Now this is for certain specific brahmana dravyas. With the other drugs, the dosage schedule is not really properly mentioned. Whereas in Shargadar Samhita, there is a very specific protocol. If the child is Kshirada or Kshirada, then half of the adult dose is suggested. Kshira Annada, it's 3/4 of the adult dose is suggested. For Annada, the same as that of the adult dose, irrespective of the age. This is what mentioned in Shargadara. So maybe that kind of a protocol also is valid. येषां तदानां ये योगाः प्रवक्ष्यन्ते अगदङ्कराः तेषु तत्कल्कसंलिप्तौ पायेत शिशुं स्तनौ. Another of the method of giving the child, medicine to the child would be apply the drug over the breast of mother, and as a child sucks the milk, this drug also is consumed along with the food. So this is based upon the advice of the physicians. Agadankaraha, the physicians, they would recommend which of the diseases can be managed with this kind of administration. So another mode of administration of the drug to the newborn is by applying the drug over the breast. एकं द्वे त्रीणि चाहानि वातपित्तकफज्वरे पायाहितं सर्पिः इतराभ्यां यथार्थतः न च तृष्णाभयादत्र पायेत शिशुं स्तनौ विरेकबस्तिवमनानि ऋते कुर्याच्च नात्ययात्. मस्तुलुङ्गक्षयाद्यस्य वायुः ताल्वस्थिनामयेत् तस्य तृड्दैन्ययुक्तस्य सर्पैर्मुदकैः श्रुतं पानाभ्यञ्जनयोज्यं शीताम्बूद्वेजलं तथा. Now some of the common pediatric newborn diseases are the febrile conditions, fever, Vatapitta Kapajvara. In that condition, whether Sanyapana can be continued or not has to be assessed. If the Sanyapana cannot be done, if the child cannot feed the breast, then ensure that the child doesn't get dehydrated. Tasna bhayat. To prevent the dehydration, you have to give some other alternative choices, or maybe the Sanyapana has to be given somehow, and unless the mother is given Virechana or Basti, as far as possible, the Sanyapana has to be encouraged. Breastfeeding has to be encouraged even in Jara conditions. If the child has, newborn has some abnormality of the mastulunga, the brain or the growth of the upper part of the body, or Thalvastinamayat, if there is a cleft palate conditions, Thalvastinamana is the cleft palate condition. In such conditions, the breastfeeding may not be possible. Child may not be able to suck the breast. In such conditions, you have to give Shitambudvejanam and Sarpi Madhurkai Vishratam. Sarpi and other Madhura Dravya have to be given carefully, and ensuring that the child takes the food properly, and if at all there is necessity, the child has to be resuscitated with cold water. Now there is a possibility of aspiration when you feed the child. To prevent that aspiration, or if the aspiration occurs, Sushruta suggests the resuscitation with the shitam, cold water. Now of course you have the protocols of suction and the other protocols of preventing these complications. Vaten adhamsam nabhim sarujam thundi samnidam मारुतग्नेः प्रशमेत स्नेह स्वेदोपनाहने गुदपाकेत बालारं पित्तग्निं कारयेत क्रियां मसाजनं विशेषेण पानालेपनयोः हितं. The other complications which can occur quite frequently in the newborn would be the umbilical hernia, the bulging of the umbilicus, and that's called as a thundi. And for that, Batagna Dravya has to be given with the Sweda and Upanaha. Another is Gudapaka, proctitis, septic complications that also has to be avoided. क्षीर आहाराय सर्पिपायेत सिद्धार्थ गौचा मांसी पयस्य अपमार्ग शतावरी सारिवा ब्राह्मी पिप्पली हरिद्र कुष्ठसिंधव सिद्धम. क्षीर अन्नादाय मधुक वचा पिप्पली चित्रक त्रिफला सिद्धम. अन्नादाय पंचमुदी क्षीर तगर भद्रवारु मरीच मधुक बिडंग द्राक्ष ब्राह्मी सिद्धम. तेन आरोग्य बल मेधाविंशी शिशो भवति. The different gritas are suggested according to the. Now, one of the important issues is assessing the pediatric dose calculation. How to assess the pediatric dose? From the current pharmacological point of view, there are mainly three methods. Either calculation according to the age, for that you have either Young's rule or Dilling's rule or Freire's rule, or calculation according to the age also is done by Clark's rule, and the other is by body surface area. The formula, in brief, without going much into that, the formula is Young's rule is age of the child divided by age of the year plus 12 multiplied adult dose, and in the Dilling's rule the dose is age in year divided by 20 into adult dose. Freire's rule is age in month divided by 150 into adult dose. So any of these protocols could be used for deciding the dose of the medicines in the present day situation. Clark's rule is based upon body weight, where the body weight in pounds divided by 150 into adult dose, or the body weight in kilogram divided by 70 is into adult dose. And body surface area, the dose calculation is done by child's body surface area divided by average adult body surface area, and average body adult surface area of adult is considered as 175 centimeters, or 175 height is 1.85 square meters, and this is multiplied by the adult dose. This also is the other protocol. बालं पुनर्गात्रसुखं गृह्णीयात् न च एनं तर्जयेत् सहसा न प्रतिबोधयेत् वित्रासभयात् सहसा नापहरेत् उत्क्षेपयेत् वा वातादिवात विघातभयात् न उपवेशयेत् कौब्जभयात् नित्यं च एनम् अनुवर्तेत प्रियशतैः अधिकांशुः एवम् अभिहितमनः अभिवर्तते नित्यम् उदग्रसत्त्वसम्पन्नो निरोगः सुप्रसन्नमनाश्च भवति. The child has to be held in a proper comfortable position, and the child should not given a rigorous movement made to jump up or sit unnecessarily, or before the sitting capability has occurred should not occur, because it can result in the different complications as such. And they should not be exposed to Vatatapa Vidyut Prabha Padatala Shunyagara Nimnasthana Graha Chayadibhyo Durgrahe Upasargatascha Balam Rakshet. Child has to be protected from any possible complications due to the environmental factors. न अशुजौ विस्त्रियत बालं नाकाशे विषमेन च न उष्णमारुतवर्षेषु रजौ धूमोदकश्च क्षीरसात्मतया क्षीरम् आजं गव्यं तथा पिबा दद्यात् आस्तन्यपाय पर्याप्तेः बालानां वीक्षमात्रया. The child has to be provided sufficient milk if mother's milk cannot be given, and it could be ajam or gavyam. Goat's milk or cow's milk can be given. Goat's milk is considered to be more closer to the consistency of the human breast milk than the cow's milk. Shanmasam enam prashayet laghuhitam. For 6 months you have to take care of it. Intyam avarodharascha स्यात् कृतरक्षः उपसर्गभयात् प्रयत्नतश्च गृहोपसर्गेभ्यो रक्षाः पालाः भवन्ति. अतः कुमारः उद्विचरे त्रस्यति रोदिति नष्टसंज्ञो भवति. नखदशनैः धात्रीम् आत्मानं च परिणतति. दन्तान् खादति कूजति जृम्भते भ्रुवौ विक्षिपति ऊर्ध्वं निरीक्षते फेनमुद्गमति सन्दष्टम् ओष्ठक्रूरो भिन्न आमवर्चाः दीनार्कस्वरः निशि जागर्ति दुर्बलो म्लानाङ्गो मत्स्य चुच्छुन्दरी मत्कुणगन्धः यथा पुरा धात्र्याः स्थान्यम् अभिलषति तथा नाभिलषति इति सामान्येन गृहोपसृष्टलक्षणम् उक्तं विस्तरेण उत्तरे वक्ष्यामः. गृह उपसृष्ट these infections by the organisms, and graha lakshana and graha are mentioned in a separate chapter later on in the chikitsa. There we will have more detail, but in general, when the behavioral aspects, consumption of the food and the child's attention to the surroundings has been changed, that's a sign of graha. And shaktimanta chainam jatpayata varnam vidyam grahayata. The next is education of the child has to be considered, and the child has to be educated based upon the capability. And of course, Sushla reaches to that level where the child gone up to the level age of aging, this marriage also. Athasmihi Panchavimshati Varshaya, at the 25th years of the child, Shodasha Dashavarsham Patni Mavahet, 16 years of female has to be brought in as a marriage, and Pitriya Dharma Artha Kama Prajaha Prapsyati. That's the responsibility of the parents, that the child has to be married, and so up to 25 years till that product, now I will not use the child, word child, has married. That's the responsibility, that's a part of the garbhinivyakarana, very interesting. Una Shorasha Varshayam Aprapta Panjamishyatim Yadi Adatte Viman Garbha Kushista Savapyadete Jato va Narchiram Jeevet Jeevet va Durbharendriya Tasmat Atyanta Balayam Garbhadhanam Nakarayat. So the optimum age or minimum age for the fertilization of a woman is considered as 16 years, not before that. Una Shorasha Varshaya. If the fertility has occurred, if the conception has occurred before the age of 16, then there is a possibility that the growth may not be affected. And if the male partner is less than 25 years, so 25 years and 16 years are considered to be the minimum time limits for the marriage. Child marriage was not yet practiced in Vedic period. Now we consider child marriage as one of the sins of this Indian culture, but it is not the original culture, it has come later on. Then Atibradhayam Dirgaroginyam Anyana cha Vikarayam Upasithayam Garbhadanam Naiva Kuryata. In the older age also, it should not be done, fertilization has to be done. Similarly, in the old age also, it could be, in the old age of the male partner also can result in complications. After पूर्वोक्तैः कारणैः प्रतिष्ठति गर्भे गर्भाशये कटिवंशन बस्तिशूलानि रक्तदर्शनं च तत्र शीतैः परिषेक अवगाह प्रदेहादिभिः उपचरेत् जीवने क्षीरपानेश्च गर्भस्फुरणे मुहुर्मुहुः तत्सन्धारणार्थं क्षीरम् उत्पलादिसिद्धं पायेत् प्रस्रंसमाने सदाह पार्श्व पृष्ठ शूल असृद्धराणाम् आनाह भूतसंगाः स्थानास्थानं प्रक्रामति गर्भे कोष्ठे च संरम्भः तत्र स्निग्धशीताक्रियाः. These are the possible complications of the post-conception period during the growth of the fetus. Of course, these issues we have discussed in detail in the previous chapter, so we'll just skip this part. Then you have to ensure that the growth of the child, the fetus would be proper till it reaches to the level of labor, and the nourishment is considered. Atavudum masan manikam mokshayagmaha madhukam shakabijam payasya sridarja. This about the protocol of the mother, it is repeated now. These are all the issues of the repetition, so we will just leave that as it. निवृत्त प्रसवायास्तु पुनः षड्भ्यो वर्षेभ्यो ऊर्ध्वं प्रसवमानायाः नार्याः कुमारो अल्पायुर्भवति. A minimum gap of 6 years has to be there between one child and the other child. This is again very standard protocol given by Sushruta. It's not that the a woman is considered to be become pregnant every year and so on. That's not the protocol. There should be a minimum of 6 years gap. अतः गर्भिणीं व्याध्युत्पाव अत्यये छेदयेत् छर्दयेत् मधुर अम्लेन अन्वोपयितं. This is about again, these are all the issues which we have already discussed. So it's a repetition of the same in the previous chapters, right? So we'll just skip that part. With this we conclude इति सुश्रुतसंहितां शारीरस्थाने गर्भिणी व्याकरणं शारीरं नाम दशमोऽध्यायः, and it also concludes the शारीरस्थान. We'll wind up today. If there are any questions, then right, okay. It's already late, so we'll wind up today. Thank you.